Hi everyone, this is Dr. Shweta Patel, and today's topic for our live is going to be about planning for pregnancy. And what I mean by planning for pregnancy is the steps that you can take even before you become pregnant to ensure that you have the most healthiest outcome and that you have a comfortable and safe pregnancy. So one of the first things that I usually recommend is reviewing your medical history and seeing if there's any health condition that you may already have that could impact the pregnancy. Examples of this would include thyroid disease, high blood pressure, a history of blood clots, history of diabetes, anything that you may have been taking medication for long term or had a history of in the past or were hospitalized for. Those would be good things to bring up to your OBGYN in that discussion about what you can do to get things in order. If there's any needs for changes in your medications to get your thyroid condition more better under control, or if you need to improve your diet, or if you need to improve the medications you're on for diabetes, these are the things that you can do now, and it would be more effective than waiting until you're already pregnant. The next thing would be, just in line with that, would be what medications are you on? Most medications are typically going to be safe to continue in pregnancy. Some are absolutely not. And so the best way to have that discussion is bring it up again with your OBGYN and see if there are any medications that you need to continue because they are improving your health, but at the same time are not safe or considered to be kind of on the fence in terms of safety in pregnancy. And there might be alternatives that you could be switched over to even before you become pregnant, so you have plenty of time to adjust, and the impact of that previous medication is not there on the pregnancy or you. One of the bigger ones that this kind of comes into mind is when a patient has high blood pressure, and there is a whole spectrum of medications that you can be on when you have high blood pressure to control it. Some are considered to be very safe in pregnancy, others are not ideal, and there are a few that can actually directly impact the pregnancy growth and the pregnancy's renal system or kidney system. And so making sure you're not on the latter types of medications is very important, but you can't just stop these medications necessarily. Your blood pressure also needs to be in great control to have a healthy pregnancy. And so making sure you discuss that and seeing if you want to switch to a different medication since you have time before, and or whether you want to continue any medications into your pregnancy so that they would continue to be maintaining your health. Other things to look into would be things like any kind of social personal habits that you might be engaging in. Primarily what I mean by this is any use of alcohol, smoking, any substance use or recreational drug use. These are things that we definitely want to make sure that you are either minimizing or stopping. Pregnancy happens to be a great time to consider trying to stop smoking altogether. There's a lot of motivation there. It's not just for you, it's for the pregnancy as well. There are things that we can do to help you along in that process. Definitely want to minimize to eliminate alcohol intake. The real answer is that, to be completely frank, we don't really know what the right answer is when it comes to the right amount of alcohol or what is considered to be a safe amount of alcohol intake in pregnancy. I will say that as a physician, personally, as a person who has physician friends, it would not be unheard of for a woman who is pregnant to have had a glass of wine once or twice in her third trimester. With that being said, this is definitely not encouraged, and it's definitely not something we can assure you that it's going to be safe. We don't know how even a single glass is going to impact a pregnancy, especially in the early formative weeks. And there is a condition called fetal alcohol syndrome, which again is not directly quantifiable, as in it's not that anyone who's a heavy drinker is definitely going to have this outcome in their pregnancy. And it's not that if you're only drinking one glass or once in a blue moon that you won't. There is no direct correlation, which is why as OBGYNs we give you the same line, which is avoid alcohol intake as much as you can. Same goes for any kind of recreational drug use or substance abuse. These kinds of behavioral conditions can have a significant impact on the pregnancy as well as mom. They can compromise mom's heart as well as pregnancy's growth. Wanting to take a guided approach in coming off some of these kinds of drug substance uses, because some of them can have withdrawal effects, but you definitely want to have a frank conversation with your doctor about what to do and how to safely come off of some of these personal habits. Other things to keep in mind: you want to start taking prenatal vitamins even before you actually become pregnant. Majority of women are already pregnant before they even realize and start considering taking prenatal vitamins. And one of the critical times for needing folic acid is in those early formative weeks, where it's 3 to 8 weeks, and most women have not even detected that they're pregnant yet, which is why I usually recommend, and most OBGYNs will do the same, that if you are considering pregnancy, actually start taking prenatal vitamins in advance. Don't wait till you're pregnant to start them. And if you're having a hard time taking them or keeping them down once you're pregnant, you can discuss this with your doctor about what are your alternative options. A common question I get is, which is the best kind to take? I usually say, if it says prenatal vitamins on it, it's the best kind to take. There are several different varieties out there that are higher end. There are the classic, Publix brand or Walmart brand. I can tell you for certain that as long as they have the right vitamins in them, in the right amount, specifically we want to make sure that you have ample amounts of folic acid, calcium, iron, vitamin D. If your prenatal vitamin has all of these things, then it's considered to be a good, sufficient prenatal vitamin, even if it doesn't cost an arm and a leg. Another thing to consider, most insurance plans will actually cover the cost of prenatal vitamins. So before you go rushing to the grocery store to buy your own, you may want to consider actually having your doctor put in a prescription for them, because hey, if it's covered, why not, right? Immunizations. Another thing that's often overlooked is your vaccine status. If you are sufficiently immunized against some of the potential viruses that we never think about as adults, but can impact the pregnancy if you're exposed or develop an infection. Specifically, measles, mumps, rubella, making sure you are up to date on your chickenpox or varicella status, and seeing if you had these vaccines in the past. You can have your doctor draw levels to see if you are actually still immunized, and if you are, then you're good to go. If you're not, then given how you are doing this before you even become pregnant, now you have the opportunity to actually respond and go and get vaccines done that may otherwise not be considered safe in the pregnancy. So definitely, again, make sure your immunizations are up to date. Vaccines such as the COVID vaccine, the flu shot are okay to get in pregnancy, but vaccines that are considered to be any kind of live attenuated viral particles, anything that is potentially going to cause a prominent immune response, we want you to see if you can get it before you even start becoming pregnant. So again, measles, mumps, rubella, your varicella status, and I think those are usually the ones. The other one that you can actually get in pregnancy is the Tdap vaccine. Tdap standing for TDAP, or tetanus, diphtheria, and pertussis. The primary component of that vaccine that a woman needs in pregnancy is the pertussis. Most people think, oh, I've had a tetanus shot, I don't need this, but it's actually the pertussis part that we're trying to make sure mom is immunized against. The reason being is that most adults won't have any issues with pertussis, but newborns can actually acquire pertussis virus and then subsequently develop whooping cough, which can be very life-threatening for them or life-compromising for them. And so the best time for that newborn to be protected against it is from days 1 onwards. And the way we can accomplish that is if mom actually gets the vaccine in pregnancy, and then she's passively sharing her immune response with the baby through the placenta. That's pretty much it. I would say if you guys are planning on starting to try, make sure you are doing those things that we talked about, and of course track your menstrual cycles so that you have an idea of when to actually try for pregnancy. And if you have any questions, you can reach out to me. Thank you so much for joining in today. I am actually going to do a live tomorrow to discuss endometriosis, so I hope you can tune in. Have a great day, guys.